Hello, Richard Burr. My name is Leslie Artiga, and I'm a registered nurse with a Bachelor's in Science of Nursing. I'm currently practicing at Novant Health in Wilmington, North Carolina. I'm contacting you today to inform you of the pressing issue of safe nursing ratios and its correlation to patient outcomes and community health. Did you know that per the Journal of American Medical Association, the likelihood of death increases by 7% for each additional patient in a nurse's workload above the baseline nurse to patient ratio? A study done on a surgical unit in Illinois hospital determined that each additional patient the nurse took, there was a 16% higher odds of death and length of stay. By mandating safe nursing ratios, not only would there be millions of dollars saved in hospitals, but more importantly, thousands of deaths could be prevented each year. It is not a hidden fact that healthcare has been stretched to its limits over the past couple of years with recent COVID pandemic. At face value, it may appear that limiting the amount of patients that a nurse could have by mandating safe staffing ratios would appear to be one more factor that limits access to healthcare. But I would challenge you to rethink this. For each additional patient per nurse, there's a 12% higher odds of in-hospital mortality, as well as a 7% higher odds on readmission within the next 60 days. Given these statistics, patients are more likely to come back, as well as need higher level of care if they have poor outcomes within the hospital. I would challenge you that increasing patient loads on nurses is in fact not benefiting our community, but compounding the problem of stretching healthcare further. Currently, there are only 7 out of the 50 states that mandate safe nurse-to-patient ratios, and North Carolina is not one of them. Nationally, there has been a new bill introduced called the Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2021. It's a federal bill that requires hospitals to submit staffing plan that complies with the minimum nurse-to-patient ratios and post the ratios on that unit. This bill also allows for a nurse to refuse an unsafe assignment and prohibits hospitals from taking adverse reactions against the nurse for refusing an unsafe assignment. The bill also states that the Department of Human Health Services may impose monetary penalties against hospitals for violating the ratio requirements. The studies have proven that patients have better outcomes when nurses have mandated safe ratios. The question is no longer do nursing ratios impact patient outcomes or the community health, but rather nursing ratios do impact patient outcomes, and what are we going to do about it? I'm asking you, Richard Burr, to stand with nurses and vote in favor of the Nurse Staffing Standards for Hospital Patient Safety and Quality Act of 2021 as it moves to the Senate. Thank you to your time. I look forward to taking the next step together, not only on behalf of the nurses, but on behalf of the community as well.